guys, it's Crystal and it's Friday, which means another FAQ. And today we're going to be talking about acupuncture for the treatment of gastroparesis symptoms. And so you're probably familiar with acupuncture, you've at least heard of it. You might not have tried it though, and you might not know how effective it can be for some of the symptoms that those of us with gastroparesis deal with. So that's what I want to talk about today. I want to go through what acupuncture is, and then I want to share with you some information about medical studies that have been done, some scientific research, and give you some resources if you're interested in finding out more information about acupuncture and maybe even giving it a try. So acupuncture is very old, about 2,500 years old, and it's part of traditional Chinese medicine. And in traditional Chinese medicine, they believe that health is achieved by finding a state of balance in the body. And when the body is imbalanced, that's what leads to disease. And so energy in the body gets blocked, and that's what results from these imbalances. It's called qi, and the qi gets blocked. And so to release those blockages in the qi and to let the energy flow properly through the body and restore a state of balance and restore a state of health, acupuncture is used along the meridians of the body where the energy flows and along specific acupoints. And so most of us, when we think of acupuncture, we think of the needles. And so acupuncture can be done in a variety of ways, but especially here in the United States, the most common is having needles inserted, very, very thin stainless steel needles inserted along these acupoints in the body. And it kind of sounds painful, and before I had it for the first time, I expected it to be painful. I mean, we're inserting needles in the body, right? But it's actually, it's usually not painful, sometimes a little stinging or a little burning, but it can actually be really relaxing for a lot of people. And so there's another kind of acupuncture, or a variation, I guess, that's also used more and more frequently in the United States, and that's electroacupuncture. So it starts the same way. Very thin stainless steel needles are inserted in the body along the meridians at certain acupoints, but then the needles are attached to little electrodes that generate electric pulses, and the acupuncture is performed that way. So I want to kind of go through how this can be beneficial for gastroparesis patients and the different symptoms that acupuncture has been proven to help. Starting, of course, with nausea and vomiting. Between the two, probably the most common symptoms of gastroparesis. And there's really, there are a great deal of studies that have proven the efficacy of acupuncture for nausea and vomiting for a wide variety of causes, everything from pregnancy to surgery to motion sickness, chemotherapy. And typically the point in the body, the acupoint that is most beneficial for nausea and vomiting is called PC6, and that's on the wrist. And when we talk a little bit right at the end about acupressure, I'll talk a little bit more about that point, because that's something that you can stimulate on your own and can help relieve nausea especially. The second thing that acupuncture has been proven to help is abdominal pain. And so there aren't as many studies about this, certainly, but there was a study with over 100 patients with functional dyspepsia, and they found that 95% of them who received acupuncture noticed an improvement in their symptoms, especially pain in the stomach and in the upper abdominal area. So if stomach pain is an issue for you, and certainly for many of us it is, acupuncture might be something that's helpful, because as we know, a lot of the medications that are available to manage pain have side effects. Many of them actually delay gastric emptying, so it can kind of be a cycle, and there's no really good medical way right now to control the pain that's often associated with gastroparesis. The next thing is gastric dysrhythmia. So we talk about slow motility in terms of gastroparesis and in terms of functional GI disorders, but sometimes the stomach just, the rhythm is also out of balance. So instead of contracting rhythmically and normally as it's supposed to, it can be too slow, right? Or it can be uncoordinated. And so they've shown that electroacupuncture in particular can reduce the dysrhythmia that is sometimes seen in people with motility disorders, and it can actually enhance what's called gastric slow waves. Specifically, they've done this research on people with motility disorders. And that's particularly, like I said, electroacupuncture. And lastly, they've actually done studies that have shown that acupuncture can improve gastric motility itself. So this is obviously, that's really good news, and that's something that we should be interested in. I think it's important to note that the studies that I looked at that looked at gastric motility in terms of acupuncture, there are very particular acupoints that they found that enhanced the gastric motility. There were actually other ones that they noted in the study that suppressed motility. So certainly, regardless of why you're going to the acupuncturist, you want to make sure that you're seeing somebody who's extremely well qualified, extremely knowledgeable, and someone who is well suited and experienced in dealing with the kinds of disorders that we're seeking help for. So speaking of finding a qualified practitioner, the National Certification Commission for Acupuncture and Oriental Medicine, that's NCCAOM.org. You can go to their website and you can find a certified professional. There's also a site called the American Academy of Medical Acupuncture. I think it's medicalacupuncture.org, that I do know. And those are actually physicians who are trained in and specialize in acupuncture. So you can check that out. You can find a practitioner. And I want to say about acupuncture, the practitioner, not only is it important that they're certified and they're licensed and well qualified, but the way they actually practice the therapy can make a big difference in your results. So if you go to one practitioner and you don't get fantastic results, it's worth trying another one. I can give you a personal example. I saw one acupuncturist who was fantastic. I went every single week. I noticed a definite improvement in my symptoms. Every time I would get off that table, I would just feel like things were moving better every single week. That person moved out of town. I went to a different practitioner who came highly recommended, was very well qualified, but I got no results from that treatment, and I went for a few months. So that just shows you that the therapist that you see, the practitioner, is just as important as the therapy, especially in these kinds of complementary fields. So if the first person doesn't work out for you, try another one. Usually to notice the benefits with acupuncture, you need several sessions. So you might not notice it the very first time. So give it 6 or 8 sessions to determine whether or not it's a treatment that will or will not work for you. So lastly, just briefly before we want to go, I kind of want to connect this to some self-care techniques that you can do at home, and that would be acupressure. So acupressure is similar to acupuncture in that you're stimulating acupoints along the body, but you're doing it with, as you can guess, pressure, pushing. And so there's a point I mentioned in your wrist, and I'm going to put up a graphic so it'll probably be easier for you to understand, but there's a point about 3 fingers down under the crease of your wrist between the 2 tendons. And it's the P6 point. And if you stimulate that point, it is supposed to help alleviate nausea. Now, you can do it, certainly manually with your fingers, and you can stimulate both the wrists that way. The other thing is you've probably seen something called C-bands, and they're an elastic band, and they have a little plastic ball on the inside of one side of the band, and you put those on your wrist, and it stimulates that pressure point for you. Of course, you have to place them properly or they won't work at all. But those are very effective for some people, and that's something that you can just wear around when you're feeling extra nauseous. Again, complementary therapies are things that you can use in addition to what you're already doing. With acupuncture, and certainly with acupressure, I mean, there are very few side effects. With acupuncture, as long as you're seeing a qualified practitioner, it's a very, very small risk of any kind of negative effect. And the potential of, like we just heard, a very great benefit. I actually want to share a quote with you that I read in a review article that looked at all of the studies that involve acupuncture for functional GI motility disorders. And that said, acupuncture may have a great potential for gastroparesis, as it has been shown to accelerate gastric emptying, restore impaired gastric accommodation, and normalize gastric slow waves. So that's a pretty big statement. That's a pretty good thing for those of us with gastroparesis who are still searching for something that can help us minimize our symptoms and live well with the condition, feel good. And so if acupuncture is something you have not tried, it might be something for you to look into. Make sure you tell your doctor. Of course, you want all of your medical professionals, all of your healthcare professionals to be aware of everything you're trying. And if you have had acupuncture, I would love to hear your comments. I would love to hear your experience with that. So feel free to leave them in the comment section below. And thanks for joining me for another FAQ Friday. You can check me out on my Facebook page. It's facebook.com/livingwithgastroparesis. Or you can visit my blog at livingwithgastroparesis.com. If you're not on my mailing list, I send out newsletters every month with just some tips and recommendations, recipes for eating with gastroparesis, and you can sign up for that at livingwithgastroparesis.com. So thanks for joining me. If you found the video helpful, if you like it, click the like button, share it, and I will see you next week for another FAQ Friday.